Measles cases in Texas rose to 146 today, the vast majority connected to an outbreak in West Texas.
Many of those patients, nearly 50 of them, are under the age of 4. And today in the city of Austin, it announced a separate case not connected to the outbreak. An infant caught measles while traveling. Now some pediatricians are giving parents the option of vaccinating their babies sooner. Fox 4's Peyton Yeager spoke with a pediatrician and a mom today. Peyton.
Hi, Stephen, Heather, and Cook Children's in Fort Worth tells me it's recently reviewed its measles protocol. Right now, it is in preparation mode. Meanwhile, some North Texas mothers are continuing to watch those cases rise in West Texas.
We are preparing for hospital admissions and clinic visits as we need to.
Fort Worth's Cook Children's Medical Center is keeping a close eye on the deadly measles outbreak in West Texas. Friday, the number of measles cases in the state increased to 146 cases, with 20 people hospitalized. Almost every patient is either unvaccinated or their vaccination status is unknown. The death of an unvaccinated school-aged child was announced earlier this week.
For children and adults who are fully vaccinated, that vaccine is about 97% efficacious. It is excellent.
Children and teenagers make up the majority of the cases, with 46 patients under the age of 4. The MMR vaccine, which protects against measles, mumps, and rubella, starts with a first dose at 1 and a second at 4 years old. Some North Texas pediatricians are acting out of an abundance of caution. Richardson Pediatric Associates announced it's offering MMR vaccines to babies as early as 6 months old if parents desire. But this development doesn't yet apply to Dallas mother Becca Wicker and her 2-month-old Ben.
So that's still 4 months to go. With the rate at which measles spreads, that's a really long time. So I actually feel more concerned about measles than I did having a baby in the pandemic.
Also Friday, health officials in Austin confirmed its first case of the measles. An unvaccinated infant was exposed while vacationing overseas. Officials do not believe this case is connected to the West Texas outbreak. However, the Hays County Health Department is still monitoring a measles case of an adult who traveled from West Texas to San Marcos and San Antonio mid-February. The adult didn't display symptoms until they returned back to West Texas.
It's still possible that people exposed to this person are in their incubation period, and we are closely monitoring for this.
Health and Human Services Secretary Robert F. Kennedy Jr. appeared to backtrack on his previous comments when he said, quote, the measles outbreak is not unusual. In an ex post today, he says he recognized the, quote, serious impact of the outbreak. Now, a word of advice over the weekend, if you have measles, maybe you were exposed, do not show up to the emergency room. You're encouraged to call your primary care physician or an urgent care so that you do not risk others in the process. Heather?
All right, Peyton Yeager, thank you.
The state now says there is no rubella case in Mejia ISD after a district reported a case and closed for the day to clean up. Yesterday, the district east of Waco first reported a measles case, then clarified it was a case of the German measles, also known as rubella. The Department of State Health Services now says it has confirmed that a child had a positive result on an antibody test, which would show immunity from a previous vaccination or infection. That test got misreported to the parent, who then reported it to the school. There is no active rubella or measles case in the Mejia district.